So we're very excited to have data presented at ASCO on AZD9291. This compound is a selective irreversible inhibitor of double mutant epidermal growth factor receptor lung cancer. So what we already know is that there's a significant group of patients, about 15% in the West and about 30 to 40% in Asia, who have a mutation in the epidermal growth factor receptor that drives their cancer's growth. And currently those patients can be treated with drugs like erlotinib and gefitinib, EGFR inhibitors. But about 60% of them subsequently develop resistance to those medicines, and they develop resistance because they develop a second mutation in the epidermal growth factor receptor. What we've done is design a drug that hits both the original sensitizing mutations and also hits this second mutation, the so-called gatekeeper mutation, or T790M mutation. And this drug started dosing patients in March of 2013. And in just over a year, we've really accrued, I think, the fastest accruing phase 1 trial that I'm aware of. And we've presented data now on over 200 patients who are valuable for response. The data show that in patients with a T790M mutation who've been previously treated with an epidermal growth factor receptor inhibitor, the response rate to AZD9291 is around 64%. And we're seeing very durable responses. We haven't reached the median duration of response yet, but the progression-free survival curves are looking very encouraging, and the longest response is ongoing still at over 9 months. I think the other aspect of this story that's very exciting for us is that this drug was also designed to overcome some of the side effects that you see with the early epidermal growth factor receptor inhibitor drugs, because those drugs also inhibit the normal so-called wild type receptor which exists on your skin and the lining of your gut, and that is the reason why many patients get side effects with such drugs of rash and diarrhea. What we're seeing with 9291 is it was designed not to hit the wild type receptor as hard. It has a 30 to 50-fold potency window against the wild type receptor. And so what we're seeing is much lower and more mild side effects of rash and diarrhea. In fact, we have very low incidence of those kind of adverse events, particularly very low incidence of grade 3 version of those kinds of adverse events. And patients are really tolerating the drug well.